let's move on to residency exam preparations and what not to do. And Dr. Ajinkya Deshmukh is here to guide us on the not.
Thank you, Yusuf, for this opportunity. I finished my residency 4 years back, but I hope I still can do the justice to the topic. It's a very specific topic, what not to do. So I tried to stick to the topic in all the nots. So residency exam preparations, what not to do. So when it comes to residency exams, it can either be DNB, MS, DOMS, DO, and it can again be theory, practical, Viva, or now the AIOC pattern. So whatever the exam may it be, the basic always remains the same. Before starting the topic, this is the basic funda which we all should remember, that one who fails to prepare is preparing to fail. So a good preparation is must in any exam, in any planning in our life. So I'll be dealing with a dozen knots, 6 in theory and 6 in practicals. Let's entangle the first 6 knots of theory exams. So first knot is, please do not wait till the exam approaches. Once you enter into residency, from the first day itself, you should be learning something in each day, in each of your OPD, each of your OT, and take away 5 points and read on the same day the new case you saw, the new patient you saw, any entity you saw, but make each day count, and that will take you to long run. So do not wait till exam approaches. Start from the first day of residency is the first knot. The second one is, please do not cram up. So though there are some topics which needs to be we have to do the ratta, but it doesn't help in most of the concepts, and when it comes to writing in the theory exam or answering in the vivas also, once you know the concept well, you can formulate the answer well, and you can write it very well, in a way that examiner understands that you know the concept. The one who actually cram up the things, they can't rely on their memory that much. So please do not cram up is the second knot. Third is, do not have 100 books to read from before exam. So this is my own Kanski. So I used to put the notes on a paper and just stick it onto one Kanski. So whatever the topic it may be, if I have read from Yanov or any other book, I used to make the notes, stick it in my Kanski, so that at the end of the exam, near the exam time, I have only Kanski to read from. So I don't need to go to the 100 books to read from, because at the end your visual memory is something which will help you in the exam. That page you will see, you will remember, okay, from that part I had read, and that will help you to write the answer in the exam. Again, this is very important. Do not clutter your answer sheet. You understand, any examiner who is checking your answer sheet, he has hundreds of answer papers to examine. So make the things easier for your examiner. Once you have the clear concept, you have the clear flow of thought, and please make it a pattern that you represent it in the tabular or flowchart pattern. So whatever is the question, try to make flowchart, try to put it in the tabular form, and that will give a very easy way for the examiner to go to the point, highlight the points whichever are important. Catches win matches. So similarly, diagrams win exams. So do not underestimate diagrams. Well color coded, well labeled diagrams, specifically of anatomy and optics related diagrams, you have to practice, because a diagram, a good image can convey 100 words what full paragraph can convey. And again, practice diffuse and slit diagrams of cornea, Amsler Dewey of retina, and a well labeled diagram will give you 8 out of 10, and in very short time of spine, in the time of when you are writing the exams. The last knot in the theory exam, do not mismanage the time. Most of the time it happens that when we are starting to write our answer paper, for first few questions we know so much, we want to write everything, we give so much time in writing first few questions, and in last couple of questions we just run out of time and we just scramble something else. So distribute time equally, so that the things you know and the things which you need to think a little before writing, you give equal time for that, because all questions have equal weightage, so utilize your time smartly. Now, untangling the 6 knots in the practical examination. First is, do not forget the Shastra and Astra, and mind your Astra. So every candidate who is going for the practical exam, please take your own toolkit, 20D, 90 or 78D lens, pencil, pen, 2 scales, color pencils, HB pencils, gonio lens if possible, logbook, and your thesis in print. So please do not forget any of it. You should have your own kit with you. Dress formally, clean and tidy. Go clean shaven for guys, and do not wear flashy clothes. Be in your apron, white apron, and most importantly, your tone and body language matters in exam. So be humble and be presentive. This is the most important thing. Do not make blunders. Say what you see. Most of the time it happens, we see one finding, we try to corroborate it to some diagnosis, and then we try to put other findings to support that diagnosis. So he is my kid and he has heterochromia. So not all heterochromias are Fuchs. So it can be congenital heterochromia. So just because you're seeing heterochromia, don't try to think about Fuchs. So do not make such blunders. If you make any blunder, like any obvious thing, if you miss, then you're going to go down. So please do not make blunders. Again, do not flunk in refraction. We are all ophthalmologists. You should know refraction very well. Retinoscopy, transposition, what cycloplegic was used, what is the correction factor, and what are the different refractive error types. So what is compound myopic astigmatism, what is mixed astigmatism. At the end of it, you should be writing it in full. So always practice. Unless you practice retinoscopy, you will not be able to do it in the exam, because most of the institutes, they have optometrists or other ophthalmic assistants doing it, and we residents, we tend to forget about it and we don't know how to do it. So please practice retinoscopy, and in exam, this retinoscopy spotter, you have to get it 10 on 10. Again, do not underestimate the skills of presentation. Knowing the thing is important, definitely, but being able to express it in appropriate language during Viva is even more important. Whenever you are attending classes in your institute, practice answering the questions in full sentences. That will give you the knack of answering in the Viva also. And always use appropriate ophthalmic dialect. Like when you are describing any entity, if it is B scan, always say hyperechoic, hypoechoic. For autofluorescent, hyperautofluorescent, hypoautofluorescent. So those appropriate dialect is very important. So please practice that and do not underestimate the skill of presentation. Again, may it be your girlfriend, boyfriend, husband or wife, or the examiner, do not be sorry to say sorry. If you do not know, please do not guess. If you are stuck somewhere, think, take a brief pause, say sorry humbly, and move to the next question. Because you have a limited time in exam. Whatever you don't know, you don't want examiner to make you stuck there. So please say sorry and move next, and do not argue. Always remember, examiner is always right. Have the last knot to untangle. Do not dig your own grave. This happens most of the time. We utter something which we don't know, and then the examiner rightly catches us there and try to pull us down. So do not utter the things you do not know. Make sure that you lead your own Viva. Whichever thing you know, take a brief pause there, or stop at the thing which you know, so that examiner takes you further from there. So take the examiner to the territory of your strength, and do not dig your own grave. Instead, walk onto the flower garden which you create for yourself. Again, last but not the least, I know first impression can be the last impression, but exit is also equally important. So because that's when the marks are given in the exam. So humbly thank your examiner and leave the examiner hall. Thank you.